which ones deserve a little bit of attention this time of year. And then there's a couple of medicines we talk about that are um, pertinent to the latest chatter out there as far as fever was concerned. But so to give a balance here, this is what I want to do today, which is first just a quick introduction and to say that I've been with Boron now 31 years. Most of the time in education capacity in our pharmacy and medical teams, as well out there in the natural channel as well. The natural channel, by the way, includes all of those health food stores, and now it also, and the natural sections of mass groups that have done really quite well. My time before that was spent at Capital Drugs. It's two integrative pharmacies in Los Angeles. I was the manager and operations director there for a number of years. And during that time, as Hillary, I know you're aware, when you have herbs and supplements and homeopathics and probiotics and everything else, it gets a little hard to be an expert in all of it. And at one point early, I decided to dive deeply into homeopathy. And there was a program. It was based in the Northern California Bay Area, and I lived in Los Angeles, and it was a 600-hour, 3-year course. So for one weekend a month for 3 years, I flew up to San Francisco and went to school all weekend, but had the real blessing of coming home to a very active community pharmacy where I was challenged to put to the test everything that I'd learned. As beneficial as it's been for my professional life, I mean, I've been with Boron now all these years. At home, I have used homeopathy with 5 generations, from grandparents to grandchildren. So I'm always happy to discuss real world application of medicines as well as the didactic essentials for pharmacists. Just one slide about Boron. We are founded in 1932 by twin brothers who were both pharmacists. We are now the recognized world leader in the manufacturing and education of homeopathy. We have 20 subsidiaries, which means we have headquarters in 20 countries around the world: Canada, Brazil, Argentina, India, and a lot of European countries, Africa, and even Tahiti, if anybody wants a job out there. But the learning objectives here for today, a few essential facts. Hard to skip past this, but I'll make it quick for you guys since I know you're fairly well versed. I want to leave you also with tools, things that you can use right there in your pharmacy or share with others, as well as do a touch base on the benefits and advantages of homeopathy because it is so pertinent to the life of a working pharmacist. And like I said, I want to talk about sales, front-end sales specifically, what Americans are buying right now. And then, as promised, 3 leading homeopathic medicines will show quite clearly in the cough, cold, and flu season, and then 3 more medicines in pediatrics and fever. Perhaps less important, but it's a nice balance to the big sale ticket items. We teach at schools of pharmacy, a lot of them now. We present, and I would tell you that my experience has been that if there's 50 students in a class and I ask them, are homeopathic medicines regulated in the United States at all? There might be 5 of the 50 who will raise their hands and say, absolutely, they are. So in some ways, as one faculty member pointed out, we're still very much in the business of delivering introductory and essential knowledge. But yes, homeopathic medicines are regulated by the FDA and have been since 1938 when the Food, Drug, and Cosmetic Act was first signed by FDR and put in place. There's over 1,000 homeopathic medicines of note, and most of them are OTC, which is very useful in a pharmacy setting. There's a few that require prescription. Oops.
Hey Shane, let me
Yes,
interrupt you, but
sure.
their
Please do.
regulation, I mean, we have a repack facility here in Kansas City
Uh-huh.
for the government, but we're regulated by the FDA, of course.
Hmm.
And we're almost close to a manufacturer, but really repack. But so what the regulation, what does that entail with regards to the FDA since 1938? Are they still want you to prove that it's safe and effective like they do the other, legend prescription drugs? Or what is that regulation when it comes to that? I know that with vitamins and minerals, they don't really have a say on that because you just can't say that you're going to cure some disease. So what is
Correct.
the regulation on that, if you don't mind
No,
digressing for a second.
no, that's not digressing. No, thank you. The regulation is on the manufacturing and the marketing of the materials.
Okay.
Specifically, the FDA does come to our subsidiary in the United States, which is in Philadelphia. They have also traveled to France to see the laboratories right there.
So they
And they,
expect whoever the makers is, the manufacturers, to be underneath the good manufacturing or GMP type
absolutely.
process. Okay. Just like
Yep.
food and okay. Yeah.
Yep.
And then the
And
marketing, I'm sure that they're making sure that you're not gearing toward a disease, you know, curing a disease, basically.
well, we can say that we can cure and treat certain illnesses, but it has to be acute self-limiting conditions. For instance, you can say that, there's a homeopathic medicine that is very good for all the symptoms of a common cold, which is a viral infection. You cannot say that you can treat skin cancer. That is
Okay.
not self-limiting an acute condition. So for that reason, it is especially suited to a community pharmacy where you see an awful lot of acute care situations and patients, or there are some instances where uh, you can address with homeopathy, and it's labeled as such, acute relief for the exacerbation of a chronic condition, like arthritis, for
Okay.
instance.
Okay.
Homeopathy does not cure arthritis. However,
Right.
if grandpa is really stiff when the weather changes in December, yes, there are homeopathic medicines that can bring temporary relief and are labeled as such. And the
Right.
labeling of homeopathic medicines, Nick,
Yeah.
is done by the laboratories themselves, by the pharmacists on staff.
Mm.
And so this is where you find companies like Boron that are notoriously conservative and cautious and
Mm-hmm.
respectful of clinical history. And then there's other smaller labs out there that get clipped by the FDA when they make some pretty wild claims about what a homeopathic medicine can be used for uh, from its OTC status. So,
Okay. Well, thank you for
yeah,
yeah,
you bet. No,
expounding
no,
upon that.
thank you. I was afraid I was going to skip too quickly past things, so thank you for stopping me. And don't hesitate. This is your
Okay.
time.
Okay. All right. Well, thank you. I don't want to interrupt
Yeah,
your.
no, I'm grateful that Linda and Hillary have asked us here. Um, so, like I was saying there, you're going to see that pharmacies like Hillary's that have a solid selection of top homeopathic medicines. There are some, like the ones in California here, Santa Monica, that have enormous sets of homeopathic medicines. They've also been around for almost 100 years. And then mass market pharmacies and grocery stores now are also taking the leading uh, medicines to their shelves. Working definition. Um, I try to encourage students and anybody, if you can, just grab this because when you're working in your pharmacy, and I'm happy to share this document with all of you, by the way. I'll send it to you, Hillary, and everybody, and Linda, even though she's recording it. But it's a tough question sometimes for people if a new customer walks up and says, "What exactly is this homeopathy?" And this definition right here served me very well. It is simply a therapeutic method that uses natural substances in a unique microdose form to relieve symptoms. And customers, even the newest one, get this. They get that it's natural. Very, very small doses are used to help relieve basically some fairly simple acute health conditions. The principle of similars, I'm going to scoot through this just as a quick reminder, but this principle of similars is what guides the entire science of homeopathy. And it works, it's not terribly different from allergy shots. And in some ways, it's a cousin to vaccinations because what happens here is you got a woman come into your store and she gets stung by a bee. So you record the symptoms from this overdose of bee venom. And what you have is an unhappy woman who has pink swollen skin. It stings and it itches, and it definitely feels better. There's some relief when she puts an ice cube or runs it under cold water. So if this woman did walk into your pharmacy, you know that the homeopathic medicine that is made from a bumblebee, titled Apis mellifica, can be used to return her and help soothe all of those conditions. Now, it's a principle of similars, not a principle of exacts, because it was exactly, you could use a bee for a bee sting and nothing else, we would call it that. But because it's similar, we can also use Apis mellifica, the homeopathic medicine made from a bee, for anything else that happens to a human being that looks like this, where there's pink, some slight swelling, stinging and itching, better with cold. And so, yes, it's a bee sting, but it also could be a rash or a hive, could be a sunburn. Again, pink, red, swollen. Feel better if you run it under a cool shower, not a hot shower, cool. Or sometimes even herpes simplex 1 for cold sores. You can use it. Usually, I used to recommend it in combination with lysine in the pharmacy. So this is, in short order, the principle of similars, which guides the field of homeopathy. The
That's that,
manufacturing.
yeah,
Yes, Nick, go
that's
ahead.
great because you always wondered why they always say if you have like allergies or certain things in your area that you should
Hmm.
eat the honey that's
Yep.
from that particular area. So I thought
Hmm.
that's kind of interesting. So now it kind of fits to what you were saying, your illustration there about the
Yeah, yeah.
similars.
No, yeah, no, it's sort of a cousin therapy. They're not there are parallels, but with subtle differences. But yes, the local honey is a good idea for people who are chronically allergic at certain times of the year.
Yes, yes. Okay, thank you.
Yeah, and then this one point about manufacturing, this dilution and succussion. I cannot emphasize this enough because our critics take issue. Most of the people who criticize homeopathy severely forget that the manufacturing process is definitely this sort of dramatic dilution, serial dilution process, but they forget the succussion. And we'll come to that in a minute. But so, homeopathic medicines are largely made from plants, animals, minerals, turned into some sort of a liquid tincture. And then from that, it is scaled down through precise dilutions in a certain ratio. This here in the C scale is 1 in 100. And then with the final product, it is sprayed, a liquid is sprayed onto pellets or tablets, topicals, etc. This is the dilution part. Cannot forget succussion because succussion, and I'll show you this quick little video here if I can get it to go, is absolutely essential part of the manufacturing process. Without it, our critics have a case. But research has been done to show that without a succussion process, the material is different from what a true homeopathic medicine is. We won't go into that research, but that's all available to you too. So I'll show you this. It just only takes a minute.
Once the homeopathic mother tincture or the first liquid dilution is obtained, one can start the dilution process. To do this, 1 part of mother tincture is diluted in 99 parts of hydroalcoholic solution. The liquid is then vigorously shaken in a calibrated device. This process is called succussion. The result is called 1C. It is then repeated to prepare the recurring dilutions, 30 times for instance, to get a 30C. The dilutions are processed inside laminar flow enclosures in an extremely pure atmosphere.
All right. You could hear the audio on that, could you? Okay. Yeah.
Yes.
It's it's uh it's absolutely mandatory. It is unique. And that vigorous shaking is calibrated specifically so that it is duplicatable and it is consistent. But research has shown that if a substance is not succussed, uh, the spectrography shows it is a different product. And we know that that is the activating force in the creation of homeopathic medicines.
So when they do that succussion and they're shaking it,
Hmm?
and is that why they got it in the alcohol because that and it doesn't dilute it too far, I guess maybe my word, but so it attaches to that whatever it is that you have, that you've actually created in
Hmm.
the alcohol, but doesn't destroy it or degrade
Correct. No, that's exactly right. The hydroalcoholic solution is the ideal formula
it.
to retain the dynamized potency, as well
Yes.
as it's a good solution to that you can consistently duplicate.
Okay. Okay. Yeah. I didn't realize that. I knew the dilution part of it, but the succussion I was not that
Yeah,
aware of.
And when I work with pharmacy students, I drill this point home till they beg me to stop because it is mandatory. If the FDA went to our laboratory and found out that we just decided we were going to skip the succussion process, they'd shut us down. It
Wow.
isn't negotiable, and it was from the very beginning part of the process. So,
Yeah, that's interesting. I mean, I didn't realize there was two parts. It's kind of like when we were in microbiology and we were
mhm.
had to bring in a spoon from home and we were going to do this, we were going to there's two stages. One, you could end up sterilizing it with alcohol, but the other part of it was the wiping effect. So you
Yep.
had to do the wiping effect to take off the microbes, off your spoon, but then there was also the alcohol. So there's two stages. So that's what it just reminded me of, not that it,
hmm
you know, but yeah, so you got
Yeah.
dilution and succussion. Okay. Thank you.
Yeah. You bet. So, going to get to the good stuff here. Now, this is where your work in pharmacy benefits from even simple knowledge, basic knowledge of the homeopathic medicines and when to use them. This slide right here that says there's no known interactions with other treatments or therapies. Perhaps the single most important piece of knowledge for a pharmacy setting, because we have people that come in and they are mainly coming to us for prescription drugs or other OTCs. And then if you have a pharmacy like Hillary's, you're going to have an awful lot of other herbs and supplements. So often people come to us and there's limitations as to what you can suggest to them. However, homeopathy gives you an ever-present option,
Hmm.
something else to add to somebody who says, is there anything else that can help my allergies? Is there anything else that will help this sore throat? Point number one. Next, um, comes to you soon enough, but the answer here is pretty simple. Um, yes, there is a lot of evidence. There's 200 years of clinical application here, and I resisted putting in a slide here that would show you all of the books from all of the different types of physicians who are using homeopathy in clinic, from veterinarians, OBGYN, midwives, surgeons, cosmetic surgeons, orthopedic surgeons, etc. But it's been used for 200 years. The fact that it's a little bit new to the American is fine, but the evidence is there and it's available, but not today. I'm not going to crank out all of this. No known side effects. Again, the microdose process comes into play here, and we do vigorously and immediately address any ADEs that we have, but we don't have anything on record ever in our 40 years here in the United States that says that there was a side effect of note in homeopathy. The one exception here, the one small exception, is fairly minor, but are topicals like arnica that you rub on for sore muscles. Arnica is made from a flower, a mountain daisy, and there are substance and the topicals use the only barely diluted arnica flower. It's closer to the herbal world as it is to the homeopathic world. So it is possible for someone to put arnica onto their skin and have a mild little reaction because they are especially sensitive to a mountain daisy. We see this perhaps once or twice a year. And all you do is stop rubbing it on. So it's nothing severe. There's no anaphylaxis, but so there's no known side effects. Certainly not in the blue tubes or any of the specialty products that you have on your shelf. You should get pretty prompt action from homeopathic medicines. And then, of course, it is available, and we'll see this in a moment, to all ages, from geriatrics to pediatrics, and it isn't terribly expensive. And as I noted here, there's a growing body of research, but we can do that at another time if interested. Scope of practice, you know this. You can use it alone. If you're comfortable enough for all kinds of conditions, you can use it, as we just pointed out, with other medicines. And there's a palliative care option with homeopathy that is noticeable, especially in chemotherapy. And for this just coincided with this presentation. I had no idea that this would be ready or was coming at this time. But there's a California School of Pharmacy, the University of the Pacific, that just released a free 2-hour CE program on the role of homeopathy in oncologic palliative care. So if you need some CE here at the end of the year, again, I can, if you both would like, I simply send you the flyer that they have, or I can just send you this PowerPoint and you can pull the QR code for any pharmacists and technicians that would like to pick up some CE here at the end of the year.
So that's self-directed. So there's no like probably we could do that through December 2026. So that'd be
Yeah,
great. Yeah,
yeah,
I'll end up doing that. So thank you for
you
having.
bet. I'll make a note to send you in a separate email just in case you don't want to, cut and paste and everything else.
Yeah, I'm trying to go to that site right now, taking pictures.
Okay, you're already there. Okay.
Yeah. Okay, thank you. But yeah, if you
But
send it
yes,
to
no,
me
there's
anyway, that'd be a reminder. Thanks, Shane.
it's one of those, it's a little bit different from, what we were trying to focus on here, which is safe, self-limiting acute conditions where homeopathy can come into play in the winter season in a community pharmacy. Because there is homeopathy that can be used at depth. And here we have palliative care. And I'm very impressed with the work that they've done, but we'll move on here. Now, some of the tools I want to leave you with, and again, I can send you this, but if you have not downloaded at the show or since, this counseling guide for pharmacists includes both homeopathy and allopathic medicines. It is comprehensive. So it is a lot of information, but you can load it to a computer, you can put it on your phone and have it to reference. It was designed for pharmacists, but don't be surprised when you find references, Hillary, to many single medicines that you don't have on your shelf. Okay. Next, if you need to, you can always just call me, or you can go to Boiron's Pharmacy Resource Center. We got a wealth of materials for your staff and others. And lastly, this is for customers. And this is the kind of thing that whether you just had a little sign in your next to your homeopathic set, Hillary, or Nick, I suppose you could put it on your website too. But this is an app. It's a free app. You go to your app store, type in Boron Medicine Finder. It's the only thing that comes up. This has 400 entries. It's really geared for the layperson, and it addresses all kinds of things. And it's handy, it's useful, and don't want to give it away, but we have much more coming soon because of the abilities of AI to help us on this project. Perhaps a year away, maybe not that much, but really useful. We have hundreds of thousands of lay people who use this because it's geared for them. And then for you guys, like we're doing right now, if you want a personalized training, just holler for me and we can set something up. Okay. And my experience at my pharmacy is that when you have so many different kinds of therapies on hand, sometimes it's easier to tag team healing. Let somebody know all about probiotics and somebody else knows about herbal medicine and Chinese medicines, and then you have a homeopathy expert. And that way you don't have to get 5 people all on the same call. You can have one person that you can go to and say, hey, somebody over there needs your help. They're in the homeopathy section. So now I want to talk about some numbers here. I don't know if you're familiar with the Spins company. They're a group out of Chicago, and for a number of years now, they've been producing collected sales data from the natural products industry. Okay. This now is going to be sort of specific to cough, cold, and flu. So this actually is a split one. This first one has both some conventional cold and flu meds along with homeopathy. But you can see here Ricola drops. Now, not everybody gets to submit to this. They only do it if they volunteer. Like you see Mucinex down here. Mucinex wants to get into the health food stores, the natural products industry. So they've asked that they now be put on, they join the SPINS data system. But when you look at cold and flu, homeopathy still, and all boron products, oscillococcinum, which we'll talk about, cold calm, the Chestol cough syrup, and throat calm are all at the top. And the percent increases is noticeable. COVID has had a stimulating effect on the layperson's search for quote natural specific care, self-care items in the cold and flu and pain management and stress categories. We're not going to go into those there, but you can see that if you were going to have a set, I might also include, you know, the Ricola drops in there too. And there's some teas as well, traditional medicine. Next, this is homeopathy only. And again, all of the boron medicines are right there at the top, all of them in double-digit growth. But you see this company called Nature's Way. They are a very reputable, they're now owned by a German company. They uh, you can see how many products they have. Might seriously considering keeping elderberry and their cold care Umka formulas on your shelf as well. Do you carry those already, Hillary? Yeah, you do. Okay. Nick, it's one of those things that if you don't, you may just want to take a look at this company because they are prominent. You can see between Boron, Nature's Way, you have 90% of all the top 20 products right there. And up here, even though their sales are down a little bit, all of ours are continued to be up there. Well, they got one there. So, and by brand, Boron has a substantial market share. So use it as an anchor, but don't let it be all alone, I would say. Make sure that you have other options for people who just maybe want to have lozenges, drink teas, etc. But you can see now the people that are being included in here from Vicks, Advil, Mucinex, Zyrtec, Tums are all looking to head towards the natural world too, because it's very high profile. Now, just specifically to pharmacy distributors, this is our internal data. So I may pull this slide when I send it to you, but Nick, this is what I sent to you when you first requested. And again, the purpose of this is to say that there's no surprises from what we just saw here in the natural channel and what we're seeing through the pharmacy distributors. For Cardinal, Amerisource, McKesson, you are looking at all of the cough, cold, flu products, Acilo, Cold Calm, Chestol, and then, of course, Arnica, Arnica, Arnica everywhere. So when we talked, Nick, at ACA, I said, you know, to start, you can keep this very simple and focused. And Hillary, your set is perfect. One point here, as we start to move in, is that when you make homeopathic medicines, there's generics as well as specialty or branded medicines. All right. So now what does that mean? It means that when you go to the laboratory process, if you're going to make a generic, and all homeopathic single medicines are generics, because nobody can own a plant, a mineral, or an animal product, right? We can't own honeybees. So they're all registered as generic medicines. They don't go through a first patented process. It's always one medicine, and usually for us, it's in a pellet form. But we do have specialty formulas, and this is well worth noting here, and they are branded. So Boron's name is on here. They're multi-ingredients that target a set of symptoms. And then we use it, as you've already seen, in all sorts of forms for delivery. But for us, this is important for this reason. Oh, Acilo, by the way, we're going to see in a moment, is actually a single medicine, but it's still a branded one. And interesting story coming here next.
Hey, Shane,
So,
let me ask you a
yeah,
question.
sure.
I mean, a lot of these names are, difficult to pronounce, let alone for pharmacists, but especially for the lay people,
Yep.
and I saw you had Cold Remedy or something on that one. You look like you branded it, but like it's on Acilio Coxium.
Uh-huh.
Why wouldn't they have, why wouldn't some of the homeopathic companies go ahead and just, I'm gonna say brand it, but have a
They call it flu ease or
yeah.
flew away.
Okay.
Yeah, well, yeah. Actually, that's a interesting conversation, and Boron has had that conversation for 50 years.
Okay.
But this is an interesting way to put. There's a story that comes with that, and I'll tell it to you in just on the next slides. But
Okay.
here's one reason why we haven't changed it, Nick. I'm gonna back up a couple slides.
Yes.
It's the number one, number two, number three selling medicine on all different sizes.
Okay. Yeah. They don't want to
And
mess up a good thing, right?
well, you know, it's interesting. You stick with an odd name so that the odd name sticks.
Yeah. Yeah.
It's a marketing decision that was made long ago. You can see it across the board, even in a world that doesn't know what that means. But
Hmm.
because it's homeopathic, the indications can be on it. And I'm going to show you why this matters here. I don't think I can.
Well, we're starting to see that in biological medications too,
Yes.
with the branded, especially the large molecules,
Hmm.
the mobs and the mabs, or however you want to pronounce that. Well,
Yep.
it's just a whole new nomenclature terminology. Yeah.
Yeah.
So, and then the other thing is when you see you got 20 or 30C on there or 6C, and I assume that is. I don't, is that reference to the dilution or is that to
Yes.
the succussion or what?
It's the number of times, this in this case, 30. 30 times the original the original tincture was diluted at
30
one
times.
in 100. In
Okay.
Roman numeral C is 100. So this means
Yeah.
30 times diluted 1 to 100.
30 times is diluted to 1 to 100. Okay. Yeah. I saw one of the other ones that had
Yeah.
6C on there. So you
And that
might
would
not
be,
have to dilute that.
yeah. And
Okay.
that's a good point because this right here can be challenging for if nobody speaks Latin anymore. And the Latin
Right. Right.
nomenclature is used for global purposes. So the
Yeah.
FDA requires it, but you can go to Brazil, Bombay, or Boston. If you look for arnica for surgery, you're going to find arnica. You won't find three different names, but
Yeah.
it is a unique challenge to homeopathy today. It's why a lot of big drug companies prefer their brand names. They don't want to give you the generic name of it. It's
Right.
just too much to memorize.
Right. And then the other one is on arnica and some of those. You all did like a side by side comparison for, like, say, joint pain on that, or
Hmm.
I mean, you have those, and so people understand that instead of
Yeah.
like getting a diclofenac gel, you use arnica or something. And how does it rate compared to those with the studies?
I don't have this on this slide,
No,
Nick,
that's
but I can tell you that we have monographs for every product, and we have that chart, that side-by-side comparison on
yeah,
all of those. And we have an arthritis cream and an arthritis tablet formula that have that exactly what you're looking for.
right.
If you want,
Yeah,
I can send you electronic versions of
yeah, it's
anything that
fine.
you want.
Yeah.
Okay.
Yeah, I think you gave me a sample to show too. So I haven't used it because I got my joints replaced. So
Oh, yeah.
I really wore them out. So there wasn't much space between the bones. So
Yeah, no, this is why orthopedists use arnica and a number of other
yeah.
homeopathics now. It can help speed the recovery. But
My daughter had real bad allergies back when, I mean, she came home from school and all of a sudden it just happened. And I don't have them, and neither did my other daughter, but she had real bad allergies. So we ended up
yeah,
taking her to the, well, allergy and asthma doctor. And we
mhm,
decided to go ahead and give her the treatments with the
right.
titrations and all. And that's really
Yep.
helped her out a lot. So it reminds me of that as well. You
Oh,
figure out what they're allergic to, then you just give them a little, whatever of that they're allergic
mhm.
to. Then they become immune to it, so to speak.
And we know that that's true. That the Arndt-Schultz law says that very small amounts have a promoting, accelerating effect. Excuse me. So,
Yeah.
um, getting to a silo and tickles in the throat, for which I don't have a medicine. So, this is real quick. Bacteria are that big, and viruses are that small. Why does that matter? Here, going to talk about flu and flu-like symptoms and this weird name, Bacillococcinum. Where did this product come from? And you can see that we can have indications for body aches, headache, fever, chills, fatigue. These are all the symptoms of something that you think is the flu, because you don't have anybody take a viral load test before selling them anything. You just need to know that that's what it feels like to them. This is a side-by-side comparison. Just remember that the flu has very sudden onset and it has a number of other things in common with COVID, but this is what you see. And in my store, it would be fairly common. Bacillo patient would come in and say, I was fine when I went to work today, but this afternoon I feel like a truck ran over me. And there's a fairly sudden onset with all of the typical feverish muscle ache, a little bit of a sore throat. I'm going to jump backwards 100 years. Now, if you do not have a real strong working knowledge of the flu pandemic, the Spanish flu pandemic of 100 years ago. It was dreadful. Far fewer people on this planet, all of the usual things, wear a mask, stay at home. But we figured that the Spanish flu killed about 50 million people around the world. All of the COVID stuff that we went through killed 7 million. Why does this matter here? Well, because after the Spanish flu, there weren't any vaccines for flu. In fact, the problem that they had was they didn't even have microscopes that were viral capable. So if you this Jean Roy is a French physician and researcher who did notice in the French countryside that when the ducks migrated and landed in a water source near a village, there was can be an outbreak of the flu. He notices in particular that the Muscovy duck in the heart and liver of the duck uh, is an abundance of a material. Even though they're healthy carriers, they don't get sick. But he created an isolate from the heart and liver of a duck, and he finds that they're rich in influenza-like viruses. Now, the problem here is that when he looks, and this is where the name comes from, Nick, when Jean Roy looks under a microscope that he has to see what the germ is, it's only bacterial capable. So all he really sees is something going across his screen in an oscillating fashion. He cannot see it large enough. It's just like a flash. He assumes it's bacterial because there's no working knowledge of viral material. The suffix for bacteria is a coccinum, streptococcinum, staphylococcinum, etc. So he assumes that he just names it an oscillating bacteria. So an oscillating coccinum. And
Okay.
so he makes the homeopathic preparation from the heart and liver of a duck. And then, of course, you're not going to give it like your daughter and allergies. You're not going to expose her to the ragweed in your area in full
Yeah,
measure. You
the actual toxin. Yeah, right.
get a very small amount prepared through dilution and succussion. And he created this medicine, and this is the complex. This is even worse than the silicoccinum, but Anis barbaria hepatis et cordis extractum.
Ah,
and and so thus the medicine is made. The formula comes to the Boiron brothers in France, and now it is the leading homeopathic option for flu-like symptoms here in the United States. There is some clinical uh, double-blind placebo-controlled trials showing its effectiveness in reducing the severity and duration of flu-like symptoms. Um, Again, this is available to you in a monograph. I'll show it to you here. It's what makes it the #1 pharmacy recommended homeopathic medicine for flu. And the monographs are very easy to hand out to customers or to just the staff to have talking points to. But the recovery rate within a couple of days is significant. The regimen is pretty simple. Kids like it. I mean, it tastes basically sublingual sugar pills, so there's no fussing with the kids. A lot of people nowadays travel with it, get on a crowded airplane in the wintertime, take a dose before you get on, take a dose when you get to the hotel that night, and comes in 3 different sizes here. On to the common cold. Now we saw that too as the #2 listed in the sales data. And no surprise because there's an awful lot of colds in this country every year. Kids get ridiculous number a year. Young women are affected. 22 million school days are lost. And uh, the leading cause of doctors' visits. And often, as I was at a medical training just yesterday, doctors will tell pediatric patients if they don't know homeopathy, I don't know, keep the kid at home and give them hot honey in some water and wait it out. Homeopathy gives you an answer because all of these symptoms here, the cough, the headache, the sneezing, the runny nose, sore throat, etc. There's usually not a fever in kids. But then we go to homeopathy, and here's all the strange names. But the point I want to make here is that homeopathy is really quite specific. We have medicines made from a red onion called allium cepa if people have a lot of sneezing and a runny nose. There's belladonna if there is a fever with nasal congestion. We have medicines for an established phase of a cold. When someone is just down and out, now they're really tired, a lot of sneezing, a lot of discomfort. There's even more hinder if the mucus is turning yellowish or green. And then, of course, if there's a loss of smell and taste, sore throat, especially if you're on swallowing. And then there's more medicines still that can be used in the resolution phase when somebody's almost ready to go back to work, but still there's a little bit of body ache and their eyes are still sore, or it's sort of landed and stuck in the sinuses. So now this is a lot of different medicines, okay? So this is what drove these next steps. Frankly, it can be really quite difficult to select a single generic medicine. You might not have enough training yourself, or your patients may not give you much information. They don't want to talk to you about it too, or maybe it's just short on time to work with them. So you take all of these medicines that we just discussed for the common cold, and laboratories like Boiron will create their own specialty formula at the advice of pharmacists and physicians. And so you have cold calm, and you can see the multiple symptoms that are recommended here, along with the advantages and benefits. And then on the back, all of those medicines that we just discussed are included in this. And so you have a formula. The obvious reasons for having these on a pharmacy shelf is the ease of use in recommending by a pharmacist or a staff member, but also the ease of self care by a patient who just says, just show me something else that I can take that's not going to interfere with my high blood pressure medication. And you can point them over there and they can see the labels themselves. And all of these medicines that we saw, multi-symptom approach, different symptoms are addressed. And that's just the advantages. No interference with any other medications. They're not habit forming. They will not knock people out and put them to sleep. And as we already talked, no known side effects. And it won't mask any symptoms, you know. If they have another illness, it will not change it. And it's good for most all ages here. And all of the directions are right there on every package. And if you have little ones, especially small ones, we also have liquid ampules if the tablets seem to be a bit of a concern, but uh, one or the other is usually enough. But for some parents, just seeing the word baby on there is a benefit. Coughs. Coughs are tough. I don't know if you agree with me, Hillary, but it's the bugaboo of everybody who's trained in homeopathy because there's all kinds of coughs and they can be triggered by all kinds of different things. But here in the winter season, we're really going to see three kinds of coughs in particular. A very, very dry cough with no phlegm. Some sort of irritation triggers it. A very productive cough where all kinds of stuff needs to be brought up and gotten out of you. And then the cough that is both, these are perhaps the most stressful, the spasmodic that turns into a real fit that can interfere with breathing, etc. Um, you have your choices on the shelf, and some of them, frankly, are go-tos for me. If, in my pharmacy, if somebody just needed to be knocked out for the night, nighttime NyQuil is not a terrible idea because sometimes sleep is more valuable than anything else. However, the homeopathic approach is really to try to transition from a dry to a productive cough to get the phlegm out, and then to loosen and then expectorate, and then also the calming of fitful coughs. You can once again, we start to see that there's multiple different medicines for each of the different types of coughs. And homeopathy can be very specific. A cough that's triggered by breathing in cold air or by any kind of a touch to that notch right down here in the pit of your throat is a Rumex type of cough made from the bryony plant root. These are coughs where these people will cough so much that their ribs hurt. Very dry, no mucus, dry throat, can be feverish, and they will cough until it hurts. Then there is a dry cough that is, again, this is a cough where people will go at it until you worry about them. And it doesn't take much to trigger it, just a simple laugh or speaking at all. Another dry and fitful cough, but this one is burning. And these people will sound like a seal. So this is a very specific kind of cough, and of course, worse at night, and they are worse when they then their head hits the pillow, but they do get some relief with hot drinks. So all of this is an awful lot of information for any practitioner to absorb and be able to delineate for a patient. Then there's the ones where you just have a very productive cough and you want to get it up and out of people and help to expectorate. And these are people now, they're so tired, they look bad. They are just exhausted.
Did they
So when
use that one for when you got that barking cough? They use that for like croup?
I was just going to say there's 3 medicines for croup, and this is one of them. But croup is I'm confident in addressing it. There's 3 different stages of a croup cough: onset, middle, and towards resolution again. And it's ASH, ash. Like if you breathe in ash, it's the way I remember this, you will have a croupy cough. But the first medicine is aconite, which we won't see today. The second one is spongia, the one we're looking at right now. And the third medicine is hepar sulf, which is if it turns into any kind of to prevent any kind of infection from it. But yes, it can address croup, but this is the one that noticeably they have that barking sound in the cough.
Right. That's why a lot of times they prescribe them when you take them to the ER, the kids or whatever, they'll give them
It's scary.
liquid.
Once,
Oh, yeah, you think they're going to die because they can't breathe. But yeah, so
uh,
they'll prescribe prednisone.
yep, nope, you will, people have good reason to give everything that they've got. And if they don't have homeopathic medicines or something else in their chest, they got to give that.
Yeah. And
Uh,
how quickly that onset does that work for something like that one before the croup or whatever? How quickly could you get
if
relief?
you're aware, I mean, if you have a clear case and definitely the person comes in and says, yeah, my daughter's just barking like a seal, and she
Yeah.
says her throat is really hot, but she still wants hot drinks. This is
Yeah.
kind of a unusual pairing, right? Burning sensation that's better from hot drinks.
Yeah.
You give Spongia, you should see results promptly. And by that, I
Okay.
mean in the first hour.
Okay. All right. Well, thank you.
Yeah. But the point of showing you all this is that I still have challenges, and I will, in my own house, rely on these branded formulas, whether it's boron or if I have other favorites. But you take all of these medicines that we've discussed that loosen phlegm for dry coughs, triggered by cold air, worse at night, et cetera, and you put them all into a formula. And the Chestol, as we've seen, was one of those 3 top leading medicines in homeopathy. Dry, productive, and fitful coughs. It really allows you to give one medicine to a family if they've got 3 kids and they all have slightly different kinds of coughs. Now, I'm going to jump over here real quick to single medicines just to tie this off. Did you have any questions about these 3 branded formulas and why branded formulas serve pharmacy well? Because wintertime, they're an easy go-to.
No, I'd just ask if you don't mind. I know Hillary's on. She does a lot of this. So, Hillary, I mean, when people come in, patients come in and they have this, I mean, do they usually ask for, like, say, NyQuil or, Excedrin or whatever? And then do you lead them to this, or how do you run your practice?
I'm a little unique because I don't carry any of that. I'll carry some, like I'll carry meclizine and acetaminophen and ibuprofen, just the simples. But
Right?
walking into my pharmacy, they expect that they're looking for this already.
Oh, okay. They're
But
already
where Shane will probably talk about and where he's already talked, he has kind of hinted to this is that most people walk in the pharmacies are there, 50 million medications. Is this going to interact? Is it okay with my small young child? Like in a situation where you have staff not knowing and doesn't have the pharmacy expertise, this is like foolproof. It's safe, right? So you don't ever have to worry or have your ear out saying what are they recommending? They shouldn't be doing that, but this is just, it's easy,
Okay.
if that
Okay.
makes sense.
And then your sales on your front end of your pharmacy, are they comparable to regular retail pharmacies, you think? I mean, on the front end? No?
No, my pharmacy sales, 65% of my gross revenue is upfront sales, not
Okay.
prescriptions. So
So,
I'm kind of a weird pharmacy, not the
But
norm.
okay.
but that's true of the better integrative pharmacies in this country, from Miami to Los Angeles, Chicago, New York, Boston, are like Hillary's. They will have very strong front end sales, and it can be the envy of others. It was true of Capital at my stores, Capital Drugs. We were about 50-50. But remember, we were in a city that was almost 9 million people. And back when there weren't very many pharmacies carrying this, but we would do between $3,000 and $4,000 a day in natural medicines of all kinds. And that's before there was an internet and
And then you're
so
usually your markup, they say your Capital Drug or whatever, and I'm not asking for any specific
no, no,
price,
you can
but
ask,
so you
please do.
figure what, 50% markup on,
Keystone it all.
pardon me?
Keystone it, yes, 50%.
50%. So it's like 100, yeah. So
And
if you
And
buy it,
they won't, like if you search boron and I got like Cardinal as my wholesaler, right?
mhm.
There won't be much markup, suggested, but you could go above that.
Yes,
so if you buy it for 5, you sell it for 10.
Yes,
Yeah.
yes. You may not, suggested retail may not be like that with some of the
Mhm.
wholesalers, but
Right. No,
they'll
yeah, they
sell.
have a suggested, yeah. And we do that too with some of our OTCs. Not this
yeah.
particular products, but we're just looking to start stocking them for our pharmacies.
Yes.
And then, yeah, and in the case of ordering not through distributors but direct, be sure to always ask for seasonal promotions.
Mhm.
They'll almost always have them. I mean, those names that you saw, like Nature's Way and Genexa and Boron, will all have specials where you can protect margin by making one purchase early in the season and then just carrying it through most of the time. Um, I'll make this next one pretty brief for you because we're coming up on the 1 hour mark. A lot of chatter the last months
Mhm.
about acetaminophen. Is it safe during pregnancy? Does it cause autism and everything that's going on in that world? Also, the fact that is it okay with kids? And particularly since Tylenol is really supposed to be used for fevers that are not low grade. They're climbing now. All right. So what homeopathy again here offers are choices. You have options. This is a great big chart. Like if we were to have I'm not going to stay on this one, but if there was a 100-hour homeopathy program for pharmacists, you would be very familiar with this educational groups charts like this, and you can see that it's clearly broken down. That if you have a fever, is it sudden? Is what the level of fever? Is it moderate, high? So there's charts that help you. But for today, just want to focus on three medicines: aconite, belladonna, ferrum phos. These are all medicines, by the way, Nick, that Hillary has on her shelf. And for point of discussion, we're going to just do it alphabetically. Aconite napellus or aconite has a fever. It comes on very suddenly. It often in the wintertime is when your kid went outside and didn't wear a scarf, didn't wear a hat, didn't even wear his jacket. And then midnight he wakes up and he's got a running a fever of 102. This is the etiology is exposure to a dry, cold wind. He wakes up, but he wakes up at midnight and he is not sweating. He still has an intense thirst. Okay. And that's the medicine there. Now let's compare it to another medicine, belladonna. Belladonna, also like aconite, has a sudden onset, another high fever, except for this is the child that is just sweating and you may have to change the pillowcase. Often there's a headache that's associated with it. And if you flick on the lights or slam the door, it's almost abuse to someone who needs belladonna. And so you can see that there's two medicines for high fevers that, by the way, you can use these with your Tylenol if this is what you're going to do, or to the person who refuses to do it because they've heard all the controversy, you do have an option now. But this is a medicine that I think that Hillary has a story about this one too. But this ferrum phosphoricum is a medicine, is a single medicine that I have used probably more than aconite belladonna combined times two in grandchildren. And it's because it's the low grade fever. It's the fever for which you should not be giving Tylenol. And these are kids where you're not sure if you should send them to school or not. The temperature is 99.9. They're kind of pale, kind of clammy, but they don't really aren't complaining about anything. And the thermometer doesn't scare you to death. And it's come on progressively. This isn't a sudden onset. So you didn't really see it coming, but it's a very easy medicine to have on hand and give it as it's unfortunate, but that there's training groups in homeopathy that call ferrum phos the homeopathic Tylenol for moms. Just something to have on hand with that low grade fever where you're just not quite sure. Go to school, stay home, visit friends, let people come over for a sleepover. Now, as an adjunct here, you know that we talked about how many different things you could use Apis mellifica for, not just for a bee sting, but also cold sores and sunburns and so on. In homeopathy, and I'll let Hillary end maybe here with this, but Hillary and I were on a call, a Zoom call, Nick, and it was about 11 months ago. It was cold in Michigan. I know that she had come into the story early, and it was really frighteningly cold out there. And I'll let you pick up the story from here.
So we were discussing, I think, about it, our first faculty meeting, and we were coming up with a game plan and how, how ACA could support boron and vice versa. And then my nose started bleeding, and I'm like, oh my, it was started like gushing. I was like so embarrassed. I'm like, what the heck's going on? So then Shane said, well, do you have any ferrum phos out on your shelf? So I went and got it. Took, I think, 3 to 5 pellets, and did that every 3 to 5 minutes, and it stopped. So what's the chances? It was such a
Really?
freak thing, but yeah, it was pretty cool. So now I'll never forget that ferrum phosphor, sudden nosebleeds, but yeah.
Wow.
The timing is a fluke like few others I've ever had in my life of using homeopathic medicines. But in homeopathy, there is, and this is a separate topic, we're going to scoot past this quickly, but there's a group of medicines called hemorrhagic medicines, medicines that have long had a reputation for bleeding, epistaxis, where somebody regardless of what it is, whether it's a bloody nose, it's surgery, it is menstrual cycle related, where the bleeding won't stop. And any medicine that has phosphoric element, like
Hey, I've got
phosphorus
a
or ferrum
message from
phosphora,
FedEx that they delivered
are
my
medicines
card
that
at
can be used for that.
12:52. Did you see it?
Oops, I heard somebody talking there. Sorry.
Did they ask you to sign for it?
I think
Okay.
you need to mute them. I think she's talking to a customer or something.
Okay. But so interesting little side bit here to remind you that there are benefits to having homeopathy on hand of all sorts, and then there's secondary uses for them that you may not see on a tube, for instance. Because ferrum phos is not going to say good for nosebleeds. It'll say low-grade fevers. All right, and so this is Hillary will recognize this, but this is what is a really solid stock of homeopathic medicines. She has all the liters sent her. She has some of the blue tubes that we talked about, plus many others, and then one of each of some of the different categories, from women's products to children and the topicals. So I'll leave you guys with this, that, if you want to go to the Pharmacy Resource Center, there's all kinds of stuff to poke around. But if you'd rather just do one-stop shopping, send me an email, say, hey, Shane, find this for me. I want something on research. I want monographs. I want to know if there's any promotions going on. And so I'll leave it at that. And I guess I'll stop sharing now so that Linda can cut us off. Any last thoughts for you as you head into the holiday season? And I know it's busy for you guys.
No, I mean, nothing. A great presentation. Really kind of got me up to speed as far as I wouldn't remember all those 40 or 50 or whatever you got,
I
the
think the
name?
biggest going into the flu season, because flu's popping up, is that Acilo. Like that, it's just as soon as my kids start have a fever and they're lethargic, I'll jump on that, and that has saved us so many times.
Yeah, yeah.
Um,
Yeah, this is one of those situations where sales data is actually to be trusted as much as the clinical trials
Mm,
because there's just it dominates. So that really suggests that people get sufficient results to come back. I mean, we have like a 94% repurchase rate on Acilla, which is staggering. I mean, that's like aspirin kind of numbers. So, yeah, no, but it's a great first step. I thank you guys for being here because this is it's a lifelong study. If you want it to be, figure out what matters most and call me, and we can just pick it up at any time. Nick, if you got a staff there that wants a quick review of whatever you decide, we can do that. And Hillary, whatever your staff needs and wants, I'm here for you.
Thank you.
okay.
Thank you so
We'll be
much. I
in touch,
appreciate
Shane.
your
Yeah.
time.
Good
All right, and
job.
I'll follow up to it.
Appreciate your
Thanks,
support of
everyone.
ACA. Yeah, we appreciate that. So thank
You
you.
bet. Thank you guys very much
Okay.
for the morning.
Bye. See
Bye-bye.
you, Hillary. Bye, Linda.